The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
When I came out, I didn't feel comfortable, I didn't feel safe, and that was a very hard place to be.
Coming out as lesbian, gay, bisexual, even now transgender, it was hard to do that. And so because of that, whenever you went in to see a doctor, you were too afraid to really actually say who you are.
The biggest obstacle, to be honest with you, and simply is this trust, right? Trust from the community on not being misgendered, not being mistreated.
The health community, healthcare, they didn't get that. At that time, they felt like everything is one fit. That no matter what happens to one community, it's going to happen exactly the same thing to the other community. And that's not the case.
The lack of data has been a major problem for a number of years. It's really only been in the last 10 years or so that the big health systems, the surveys that go out to people nationwide, have included any questions about sexual orientation, and only a handful of them have any questions about gender identity.
Oftentimes what happens, particularly within communities that don't feel safe within a medical field, is they'll prolong and they'll wait and they'll say, it'll get better, and then by the time they go to the doctor, it's so late.
My family has had issues like high blood pressure, diabetes, so I'm very mindful of that and really trying to do everything I can to resist that.
One of the things for me that I have to be careful of is, my heart. My mom died at a very young age, at the age of 43, of a heart attack.
What I really appreciate about All of Us is really taking this approach to make it inclusive of as many people as we can.
We'll have the information from 1 million people, people of color, LGBT people, people from diverse communities, to tell us about themselves.
To get their biological information into the database so that there's more information to work with when trying to develop new ways of treating people and treating those disease processes.
That's the only way we'll be able to find out and understand whatever that we need to do to take care of ourselves.
That's a call to be honest and open about being LGBT. It's really a much broader call to stand up and be counted. All of us being seen will give us hope.